Levant, and I'm so glad you're here. Here at Bundlebirth, we believe that your life has the potential to make a deep, meaningful impact on the world around you. You, as a nurse, have the ability to add value to every person and patient you touch. We want to inspire you with the resources, education, and stories to support you to live your absolute best life, both in and outside of work. But don't expect perfection over here. We're just here to have some conversations about anything birth, work, and life, trying to add some happy to your hour as we all grow together. By nurses, for nurses, this is Happy Hour with Bundlebirth Nurses. Welcome back to the pod. I'm so excited to have our new guest here for the first time. We have Sarah Coleman, Sarah with an H. We've already predetermined that we are spelling Sarah the correct way. Sarah Coleman is here from Count the Kicks, and I'm so excited to have a conversation about fetal kick counts. I feel like in my practice, it's always been something that I've taught prenatally in like a childbirth class and something that you do to assess fetal well-being. And yet I also know that at the bedside, I have also heard, particularly I will say, I think probably more from doctors than anything, that while it doesn't matter, it's not a thing. Skip it. And so we're going to get into all of that. But before we do that, I'm going to have Sarah introduce herself and tell us a little bit about Count the Kicks.
I'd love to do that. Thanks for having me. I really appreciate being here. I started out in nursing school in the late 90s. And actually my familiarity with kick counting was the golden rule was 10 movements in 2 hours. And I know some people still really, really hold on to that. And I'm sure we're going to get into that. But I was drawn to maternal health right away. I had an experience that allowed me to be present in a nursery at a very young age before I graduated high school. And it kind of pushed in nursery in, a mother baby. And I knew from that moment that that's where I wanted to be. That nurse, the compassion, the things that were happening there just really kind of lit a fire under my butt. And then in nursing school, I had the opportunity to do a clinical in labor and delivery. I can still remember my very first birth. I ended up on the outside of the door, almost about to pass out, so fun there, but it didn't deter me. And I did a special project learning about doulas. So this would have been in the late 90s when doulas were kind of getting around. And we were starting to learn how important they were to birth. That just kind of continued a fire for me. I actually stopped and took some time off to have a family. And that kind of, I never wanted to let go of the maternal health stuff. I was on the CAPA board of directors. I worked with them in an education space and really just had a lot of fun opportunities. I ended up in the education sector. I taught high school health for a while. I worked in Denver as the health education administrator for the school district there. And during the pandemic, I did an MPH, which again was so maternal health laden. And that opportunity after I graduated in 2023 put me here at Healthy Birthday. And so it's a little bit kind of about a background for me. The work that I do at Healthy Birthday really allows me to focus on kind of that education skill, which I love. I love to be in this seat talking about things with folks and helping them understand and just hear a different perspective. So that's the work that I do at Healthy Birthday. And that's just a little bit about me. Oh, I'm in Montana. Cool. You should know that. Oh, I'm in Montana. So everyone be jealous. Yeah. That I live in such a wonderful state.
I mean, Montana, I have family in Montana, and Montana is a beautiful state.
It is. I can
awesome.
Attest.
Yeah.
Yes,
especially coming from Los Angeles, where I'm like dealing with traffic and concrete and desert. When we get rain, we're like, oh, it's green.
Yeah.
It's so nice.
Let me tell you a little bit about Count the Kicks and how we got started. Is that okay?
Please. I would love that.
So Count the Kicks is a program that started out of a stillbirth experience that 5 moms here in Iowa, well, I guess in Iowa, I'm in Montana, but these 5 moms in Iowa all connected through social circles after losing their daughters to stillbirth and early infant loss in one case. And as they got to know each other, spent time with their families, one thing that they determined was that this shouldn't happen. There were too many similarities in their stories, and they really felt like they wanted to do something to prevent other families from experiencing what they had. And so they kind of got down the rabbit hole of research. They started looking like there's no education out there about this fetal movement, which was kind of a thread for them that they
Mm,
noticed that in particular, Tiffin, one of our founders, I share her story in every webinar I do. One of the things that she pointed out is that she was experiencing no movement, and she went in, she was seen and triaged, and they didn't talk about movement with her. And she felt like the next morning they went in and there was no heartbeat for her daughter, Madeline. And she was just overcome. Like, why didn't anybody tell me, anything about movement? I should have been
mm,
tracking movement. And that was kind of the undercurrent that she was picking up on. And that these movements weren't existing for Madeline, and why didn't she know, and how did she go into triage, and all of a sudden her baby is not here the next morning. And
mm,
so this was kind of the same story for the other four moms in this experience. So they started to set out, look for education. They weren't finding anything, and they also felt like no one was talking about this. So they came across something that we refer to as the Norway study. This is a clinical study that was done, and the primary researcher is Dr. Ruth Fretz. Dr. Fretz sits on our medical advisory board today. And I'm going to break this down really quickly for you, but what the study looked at was, can we reduce stillbirth by educating these parents, these expectant parents, on how to monitor movement every single day? We're paying attention to what's normal for that baby. And then if we notice something they were taught, right, you're writing it down, you're journaling it, you're tracking it. And if you get outside of this normal that's been established for you in the third trimester, get with
mm.
that provider right away. So what they saw was a reduction of the stillbirth rate is 30% in this cohort, which is significant. So
Yeah.
our founder saw this research and got in contact with Dr. Fretz, and then set forward with a plan to provide education in Iowa. So that became the Count the Kicks campaign. They filed for a nonprofit status in 2009, and the campaign was born. And so one of the benefits that they had in Iowa is a strong relationship with the University of Iowa and the Iowa Department of Public Health, which caught on to this campaign, and that led to kind of an adoption within the state. And what they saw was a reduction in the stillbirth rate across this time period, a specific time period. They've seen a 30% reduction in the stillbirth rate. Can we attribute that completely to Count the Kicks? Absolutely not. But we like to say that this is a large, large factor in what's happening.
Yeah.
And that's really important. And that's kind of how our campaign got started. And as other states were seeing what was happening and information was being shared by providers, it caught on into other states. And so what we have today, we have 34 states that are participating in Count the Kicks information and providing it to all expectant families. Providers are able
Mm,
to order materials for completely free in these states, and we provide education to them and just work with communities. We try and work across providers, and really look at the cultural adaptation of the work as well, as we look at
mm.
different populations that we're serving, because disparities exist. The reality is that stillbirth does not impact all populations in the same way. And so we're really cognizant of that. And we're really making sure that we listen to communities about how they feel about this education, and how this fits into what they do.
So you said that there are 34 states involved with the Count the Kicks campaign. What does it take for a state to be involved, and what does like the rollout look like? Because I'm also imagining that some of this feels like an undercurrent of a cultural change in maternity care, adding this into like the norms, because if it's not
Yeah.
a part of the norms, there has to be almost like a workflow change, or like it's not a full workflow change, but at least an educational shift
Yes.
um in a large quantity of, I'm thinking providers is probably where they're getting this from, right?
Yeah.
Like in the clinics. And so how have you guys gone about that, and what does it look like
Yeah.
to
So
roll it
when
out?
Yeah, and this is the work that I'm involved in. So these states, typically what's needed is a funder to make the materials free, to ship
Mm,
them for free, to provide the education. So something like a webinar that I do.
mm-hmm,
So we contract with a state. Sometimes we contract with an MCO. to make those materials free and to provide information about the campaign. We go about, we have a community impact manager, and she works to kind of what are the links that we have in the community. But then we also lean into the providers, because you're absolutely right. If we don't have provider buy-in, and when I say
Mm-hmm.
provider, we're talking OBs, we're talking midwives, we're talking nurses. Though if we don't have that buy-in, it's really difficult, right?
Totally.
To have this change. One of the big pieces that we've had happen for us in the last 18 months is the A1 algorithm. So we have the opportunity to have this CE module, changes in fetal movement patterns. And that has been really beneficial for us, because that A1 is saying, yes, we believe in fetal movement monitoring. We believe in the research behind this. They've put their
Mm-hmm.
stamp of approval on it. And then we're able to turn around and provide that to providers in these states as a part of the education that we do.
Mm-hmm.
We make these course codes available to folks to take that and to learn from that. And it's not just nurses that can take it. I know we're here for nurses, and I'm pro nurse, but everybody should really be educated about fetal movement, right? Like,
Mm-hmm.
this conversation needs to be happening in every space that a pregnant patient is entering in. It really, really does matter. It absolutely, we need that provider buy-in, and we work really hard on that. Misconceptions, they're
Mm-hmm.
rampant. We have
Mm-hmm.
to kind of work on that, and we have to work in spaces where people hold on to kind of older ideology, and they're not quite ready to give up on it, or they're concerned about the impact. If we have, all these people concerned about this movement, are they going to come in, and overwhelm our systems that are already
Yes.
very
Yes.
much impacted, and we understand that. So
Mm-hmm.
our mission is really to get the right mom in at the right time. And the
Mm-hmm.
only way how we are concerned with fetal movement monitoring to do that is for someone to understand what's their normal. What is their normal when it comes to their baby's movement pattern? And
Mm-hmm.
guess who knows that? Mom,
Mm-hmm.
right? Mom's the one who knows.
Mm-hmm.
So we have to lean into that. So that's kind of where I sit. Obviously, that's my opinion around kind of making that change. But that's a
Yeah.
huge moment for us. That algorithm that seeks to re-educate and
Mm-hmm.
re-emphasize the importance of a structured guidance around how are we responding if somebody comes in here to triage. But I
Mm-hmm.
think the component that I really want to make sure that, as we're talking today, it's not just triage nurses that need to know. It's not just that bedside nurse that needs to know. It's those clinic nurses that are going to have contact. And we hope that people are getting prenatal care, right? Who is having that contact prenatally,
Mm-hmm.
with those patients? Because that's where we really need people to initiate those conversations. We need them to have buy-in, so that as right away as someone is presenting and they're pregnant, like even in that first trimester, hey, down the road, you're going to want to pay attention to these movements. And there's these great opportunities to track movement. And there's some
Mm-hmm.
tools that can help you do that. But like, just having those conversations early and often is really important, because those bedside nurses, triage nurses, you're critical. And yes, if somebody's not tracking, we want you to teach that. But
Mm-hmm.
we got to have it prenatally.
Yep. Totally. Totally. So let's say I'm a patient and you're my triage nurse. Let's go with triage nurse. And I come in at 32 weeks because I have a headache and blurry vision. They're ruling out preeclampsia.
Mm-hmm.
And I don't have preeclampsia, by the way. I'm actually healthy and I just was a little dehydrated. I got a bolus in triage and I'm feeling better. And you're doing your discharge education, but you are a expert in count the kicks information. And so, what would be your form of discharge sort of training for me at 32 weeks? And like, what would you say to a patient?
Yeah, well, I'm gonna need to know, are they counting before? Do they even know about
I
this
don't even
before?
know anything about what the heck you're talking about, actually.
Yeah, so
Nothing.
a really great way for you to get to know your baby and for you to kind of keep tabs on your baby is to understand how they are moving every single day. What
Mm,
is that normal pattern for you? So there's an opportunity for you to track those movements. And you may have heard about kick counting in other spaces before. we really want you to pay attention to all movements because we want you to get to know what feels normal for your baby, what time of day that's occurring. And so, one of the best ways that you can do that is to pay attention, pick a time when you know baby is usually active. And the way it's usually when you're getting ready for bed. Some people
Trying to
think
sleep.
that obviously, when you
Hmm.
need sleep, your baby is really active. So just laying down and paying attention to your baby. Take a look at the clock. See how much time it takes for your baby to get to those 10 movements, and then repeat that every single night until you deliver. We want you to pay attention every single day. So you may find that you're at 15 minutes, you may find that you're at 22 minutes, but what's your baby's normal? Where are they falling? There's, a great tool. You can use the Count the Cakes app, completely free to track those movements. You can write it down in a journal, but we want you to understand what's normal for your baby. And then if you notice one day that you haven't felt baby move in the same way, or baby is moving really fast and it's different than what you normally experience, we want you to come back right away. We want you to
Mm.
let us assess you. We want to understand that you and your baby are okay. So try that one out and think of it as a bonding activity for you and baby. And if you have a partner at home that wants to get involved, have them be the timer. This is an activity you can do to not only bond with your baby, but to bond with the people who are going to help you birth and be a parent.
I was thinking back to when I was a brand new nurse. I'd have these patients who would just not progress. No matter what I tried, they were stuck. I finally would go on break, and that one experienced nurse, you know which one it is, took over for my break. And by the time I came back, the patient was complete, which is amazing, yes. And I'm so grateful for them. And it was also so frustrating to feel that helpless, to not know what to do, and then ask, "What did you do?" And they actually can't tell you. If you know me at all, you know that I get obsessed and cannot stop until I find all the answers. And this one got my brain going. I wanted to figure out what the heck so many of our experienced nurses were doing, and more importantly, to finally understand the body in a way that we are never taught. I wondered if there were things I was doing that could either help or hinder the labor process. And by the way, I learned there is. I wanted to equip myself with tools I could use with my hands tied at the bedside, well, both as an L&D nurse, but especially now when I'm attending births as a birth coach and my hands are tied. I'm not able to titrate the pit, I'm not able to call the doc for interventions, and I'm relying fully on the physiology of the body to help labor work. And after reading hundreds, if not thousands of resources out there and putting in thousands of hours of work, I figured it out. And I want to give you that too. If you've ever felt helpless, hopeless, or alone in your practice, you are not the only one. More than 7,000 nurses have now taken our physiologic birth class, and they describe feeling energized, empowered, and equipped for their very next shift. They walk away with practical, repeatable tools they can use with every patient. Not a one-size-fits-all prescription approach, but the ability to critically think your way through any birth scenario. A way to look at the body and know exactly where to start. You can activate physiology and optimize the systems that actually make labor work. Together, we can change the game in obstetrics. So if you're ready to feel confident instead of stuck, equipped instead of overwhelmed, and connected to a community that is committed to excellence, knowing that you're not alone, join me at our next physiologic birth class. It's truly a masterclass for every nurse to apply with every patient. Link is in the description. I can't wait to see you there. So I heard this nurse tell me that if I didn't feel my baby move for a little bit, that I heard this thing about like juice or ice water. Is that something I should also do before I come in?
No, we want you to just come right away. We want to see baby without you doing anything. We want to not delay care. And we also want to see what's going on with baby before we introduce something. We
Mm.
introduce a change that could affect that pattern because baby may perk up for a little while, but that's kind of going to mask what may really be going on. So
Mm.
come see us right away. Don't do any of that. Don't go get a candy bar. Don't go drink Dr. Pepper. Just come in and see us right away.
So let's say I've been doing this for like a week, and I kind of know already because I know my baby. And my baby is definitely most active at night between like 8 and 9 p.m. And I've been doing this, but I feel like it took me like an hour to get to the 10 kicks, but normally it would take about 15 minutes. Is that a reason to
Yeah,
come in?
that is definitely a reason to come in. That's not your normal pattern. You did it for a week. We want you to keep doing it, but we
Yeah.
do want to evaluate you. We want to make sure everything looks good. So when you go from 15 minutes to 60 minutes, that's a big difference. Also, we want to think about as you're tracking those babies' movements, how hard are those movements? Like what's the strength of them? Is it normally like a fluttery feeling and then all of a sudden it's like real jabs and it's really furious kind of feeling? That may be something that may indicate something needs to be looked at with you and baby. So again, we just want you to come in and your intuition, we always want to respect your intuition. We always want to respect your voice. We want you to know we will listen to you and your concern. And we will look at you with the tools that we have and we will make sure we're on the same page as far as your baby is concerned. We'll make sure that we can see your baby, hear your baby, and if there's something to be looked at, we're going to make sure we take care of that too.
What I think is fascinating about this is sort of like I'm thinking about all the things that I have heard as a
Mm-hmm.
nurse on like how to train, how to talk about it. Decreased fetal movement, we know, or at least I was taught in triage, if somebody comes in with decreased fetal movement, like I'm like, okay, hello, let's sit you down and let's get you on the monitor immediately. Like
Right.
there's no like chit chat, change in the bathroom, blah blah da da da, delay. It's you want to be taking those and seeing those clients right away.
Right. Right.
Um, but I think as far as misconceptions, do you want to speak to some of the misconceptions that you hear in education, in our training, and like sort of set us straight on what's best practice for all of this? One of them is why I brought it up is like the juice thing. I mean, I've
Yeah.
said that, but I think as
Yeah.
I'm thinking about it, I'm like, you're right. It's sort of like we don't want to mask a fever in labor by, cooling them off and throwing ice packs everywhere. If they have a fever
Yeah.
and an infection, we want to treat the infection.
Right. And
And
that's the
so,
big one for me. Like, I think we have talked about a couple of misconceptions here, but let's go back and pick them up. But the big
mhm,
one for me with the juice, or you're changing how you're masking. Like, at the end of the
mhm,
day, you're masking. Like, if you were to look at this from a research lens, you've changed a variable, right? And so you may fix the problem for a little bit, but in an hour or two, we're back to the same problem, if that's the problem, right? With baby. So the one that, in the A1 pathway, they talk about delay in care, right? And
mhm.
that's, and what you spoke to, the chit chat. Now you can do that while you get somebody on the monitor
Sure,
efficiently,
of
right?
course.
Right. But like you said, let's not go down the hall and pick out our juice before we come back that you're going to have after the NSD, that, like all those
Yes.
things, right? So I think that that is something for me that I have leaned into, is that change in that normal pattern. And
Mhm.
then you've gone and introduced another change, right? And so how do we efficiently, quickly diagnose and get to the root of the problem if you've changed a variable, right?
Mhm.
So, but the delay in care is also one of those things that's related to that. We've heard things like rubbing ice on the belly, and I think like you were going there with that. Like, we had somebody in a southeast state, a nurse was, said, okay, well, let's get the ice bucket out and start rubbing your belly down and see if we can get baby to respond. Well, baby may respond, but is that
Mhm.
truly a representation of what's really going on? Like,
Yeah.
absolutely not.
Yeah.
Other misconceptions we hear are 10 and 2. And this is a big one that we kind of fight a little bit to get some ground on with some providers, not all, but with some providers. They really hold to that, right? So, what if someone's normal is normally 6 to 8 minutes and then
What's
they go
10
to
and
two
2? Sorry, I don't know
hours?
what
So,
10 and 2
10
is.
movements in 2 hours.
Oh, got it. Okay. 10 and
Yep.
2. Yep.
hmm So, what if someone's much quicker than 2 hours and they're, 6 to 8 minutes? I was at a baby shower and this woman came up and she was like, I'm 4 minutes flat. She showed me the app. I was like, wow, she really was quick. Also depends on time of day, all those things, right? But
Yeah, yeah.
you're normal. So if you're sitting there and you always count at 5 p.m. and at 5 p.m. you're done by 5:12 and now it's 5:55, like, but okay, in my
Hmm.
head, I've got 2 hours to make these 10 movements happen. Well, what happens if it's too late?
Mm.
That is the worst outcome that you can
Mhm.
have as a nurse and a provider, right? Is someone who comes in and there is not a heartbeat.
Yeah,
That
totally.
that's what we
Totally.
do not want to have. So for us, our perspective, leaning into the research, is get to know what your baby's normal is instead, right? Knowing what your baby's normal is, if you have a deviation in that pattern, you get it checked out. That's kind of where we hold some ground, and we speak to the individuality of a pregnancy. Every baby's different.
Mm-hmm.
Every baby's impact on mom is different. And so why would we hold to the standard of 10 and 2 if everybody's different, right?
Sure. Sure.
Why not just lean into what's my baby's normal?
Mm-hmm.
But owning that, you have to establish what your baby's normal is by investigating, paying attention, and tracking.
Mm-hmm. I think my biggest question is, and I admit I've never been pregnant. I've been around a lot of pregnant people, but is it from the research, like pregnancy to pregnancy, that babies follow the exact same pattern all the time? What I'm fearful of, and I'm sure you've gotten this before, is like I'm hearing the nurse in my brain going, we're going to have 600 patients a day with decreased fetal movement. And yet at the same time, how do you balance the fact that we do want to catch them? Like, I fully agree with you that, like, let's get them in, let's get them checked out. And if you catch one of every 50, that's great. Does every baby follow the exact same pattern every single day of movement?
Yes, that's why we track every single day. Because the more data that we have that shows us, oh, look at that.
You'll start to see it.
I'm in with 12 to 14 patterns. And that's kind of the beauty
Mm,
of the Count the Kicks app is when you are a registered
mm,
user, you see a trend line. Like you get a
yeah.
graph representation when you're done. And so you get this trend line. And so that, I think, to answer your question, is the research does show us the app that we have, like the data that we have from all these moms, is backing that up as well, that there begins to be an established normal after several days. And
Hmm.
that's what we want parents to lean into, is knowing that normal for that baby. Does that make
Hmm.
sense?
Yeah. And then the app will also show you, like, hey, alert, this is abnormal for you.
No, because
Okay.
that's a legal thing.
Oh,
Like,
okay, that totally
right?
makes
Like,
sense. Yeah.
no,
Yeah.
so that is on the onus of that
Sure.
parent who's monitoring it to go, oh my gosh, normally I'm 12 to 14 minutes, and here I'm sitting at 37 minutes. Like,
Hmm.
that seems like
It's an
maybe it's a
outlier.
problem, right? Yeah. So I hear what you're saying. I understand that. The University of Iowa, tons and tons of births. That's where I was, like tons and tons and tons of births. And I recognize that that feels like a huge weight that we're going to get everybody on them. But the reality is we're not. So we've worked with a hospital
Hmm.
in Massachusetts, and that hospital has been tracking patients as they've implemented this program at a very standard level across 5 facilities. And that program, the nurse midwife leader that I work with, she has said they have not seen an increase. She's
Hmm.
like, we're running the same kind of standard. We are educating people. And the beauty of that is they can lean into what their normal is, and they can worry a little bit less. And
Mm.
when a mom understands, okay, every day this is what I know to expect, there's a little less anxiety there, right?
Totally.
There's
Totally.
less anxiety if you know what to expect. And again, as I said in the beginning, we are focused on getting the right patient in at the right time. And will there be aberrations? Absolutely. There will be. There will be the one clinic that sees an increase in that. But if we save the 1 out of 50, like you've said, we've saved a baby, right?
Yep.
We've saved a life. And I
Hmm.
think and going back to our founders, if we're just saving one baby, we've
It's
saved
one
one baby.
starfish for our starfish lovers
Yeah.
of our story around here. Yeah.
Yeah.
Yeah, it's so
So
true.
I think I understand the concern. I
Hmm.
absolutely understand that concern, especially where we're at. My daughter is in her nurse residency year. I understand where we are at as far as
Hmm.
nurses are concerned, and the workforce. This is not meant to make your life harder. This is meant to get the right mom in at the right time, though.
Hmm. Hmm. How would you answer the naysayers out there? I'm thinking nurses ongoing. Well, this will just cause more anxiety. You kind of touched on it, but I want to be
Mhm.
really directive on that
Yeah.
particular pushback.
Yeah.
That like, well, now you're just creating an issue and they're already anxious.
Yeah. So I would point to the evidence that we have. There are some research papers out there that the more we know, the less anxious that we are. If
Amen.
we understand a pattern, the less anxious we are. We
Mm,
can lean into what we know and we can be, what's the word? I want to say affirmed. We can be
hmm
affirmed in what we know and understand about our baby and our body. So for me, the research is clear out there. We have a post-op survey so people have the opportunity post-pregnancy to say, how was your experience with the app? Tell us a little bit about that. And overwhelmingly, the app users tell us this did not make me feel more anxious. This
mm,
actually helped me understand my baby and help me understand how to come with a concern to my provider with evidence that I was
yep.
concerned, right? Because that's
Yep.
the other piece of this. When somebody presents into OB triage, like I can think in my brain, they present and we ask them as we're getting them strapped in, tell me how your baby normally moves. Tell me when the last time your baby moves. Well, in their panic
Mm,
brain, if they have not been paying attention to movement, it either comes out, well, they move all the time, or
yeah.
I don't know, which is why I'm here, right? And so talking them down, like get it, let's use our skills, our nurturing skills, our conversation. Let's try and find out what do you know about your baby's movement and lean into that. But guess what? If they are monitoring every day, they're so far ahead in that conversation.
Yeah.
Whose job does it make easier? Yours as a nurse, right?
Yep.
Like,
Totally.
okay, she says she's 12 to 14 minutes and we're at 37.
hmm
Like,
hmm
let's go ahead and document that. We're going to get on the NST. We're going to take a look at that. Do we need to advance?
Yep.
You know, or are we going to reassure and we're all going to walk away? Okay, thank you for, here's what we want to do. And we go back to that conversation you and I had in the role play.
Yep.
Here's what we're going to do from this point forward. So you are informed and you know what to expect.
Yep.
That's the way we decrease anxiety. We know
hmm
what to expect.
hmm Well, and I'm thinking about like patient satisfaction, and so much of patient satisfaction is linked to control. And there's so much that
Mm-hmm.
you can't control in pregnancy, labor, birth. But one of the things you can would be this is something you give them tangible that they're like doing their homework. They go,
Yes.
they put together a birth plan. That's one of the examples I use when I talk about birth plans. That, like, what else can they do other than make a birth plan where they feel like they've come in and said, look, here's my homework. This is what I did. I did my childbirth class, the bundle birth class. I did my birth plan and I've been doing my fetal kick counts. And here's the data that I have. First of all, we love data. I want to see that. Actually, I'm thinking like if I were to have somebody pull up their app and be like, this is how my baby trends for movement that's come in for fetal movement, I'm like, heck yeah, that's
Yeah. And
amazing, you
remember,
know?
it's not just that time of movement, it's also the strength of movement, which is another
Mm,
important piece of the
okay.
puzzle, right? Like, how is your baby moving? And what does that tell us? Like, what do those frantic movements tell
Mm,
us? Well, is there a cord problem? Is
hmm
hypoxia happening because we've had some frantic movements and normally that's not what's going on,
Yep.
Or is baby super, 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 like I said, fluttery, and normally it's like getting
Yeah.
after it. So
Yep.
I think that that's another piece. The more information we have that we know, the better we can feel about that. One of the other myths that I hear is around anterior placenta or a patient that is obese. And this is actually talked
Mm,
about explicitly in the A1 algorithm. There's, a slide dedicated to this information. The reality is that that patient may need to work a little bit harder to understand what those movements feel like. It's
mm,
not that they're going to be completely absent, but I have run into folks in my own community here in Montana who have said, I have an anterior placenta. My provider told me don't do kick counts because it won't be worth it. And I have a little bit of
mm.
an issue with that. The other thing about that is that is a, like, let's call it a bonding time or mindful time, whatever you want, space for you to pay attention to baby. And so I think telling people that just because they have an anterior placenta or are obese, they're not going to feel anything, that's not right. And again, like thinking about that respectful care, like
Yes.
don't take that opportunity away from them. You
Yes.
have then you have then taken that decision making out of their hands by
hmm
telling them that. So
hmm
again, they may need to work just a little bit harder to feel those movements. They may need to pay attention in a different way but
Hmm.
no less rewarding at the end of the day, right? And saving space for that.
Totally. What else do you want nurses to know?
I mean, we've touched on a lot of things here, and I believe that we need to, Rose Horton is on our board, and I love
Yeah.
her. I know she was on your podcast
Yeah, she's coming
not
back
that
this
long
season.
ago. Oh, good, good.
She
I
might
love
actually
Rose.
come before you, actually. So those listening are
Oh,
like, yeah, she was here, but
she was
we are
here.
recording
She was
this
here in
before
the
her.
space.
Yeah.
Yeah. So I think, Rose talks a lot about the five tenets. And I think these definitely apply this respectful care model. When somebody comes in and tells you, we've all seen the stories in the news, right? Of these moms that tell you they're in labor and then there's a
Yes.
video and, that's not good. But when we treat people with dignity and respect, you're concerned about your baby, then so am I. I
Yeah.
want to hear about that. Tell
Mm,
me about how your baby normally moves as we're getting on the monitor. Tell me why you're concerned. What is different today? And oh, your intuition is telling you something's wrong. Well, let's find what we can find to help you feel better about it, right? Like treating people with dignity and respect. And
yes.
if they want a fetal movement monitor and you don't believe in that, treat them with dignity and respect because
Mm,
that's a piece of data that you don't have and they do.
yes.
I
Mm,
feel very strongly about that.
yep.
I am coming from a camp. Now, I'll be honest with you, I haven't been on the floor, but if we allow patients to track their blood pressure and call it in,
Yeah.
and we treat that as a piece of data that we honor and
Yeah.
respect, and we ask them to check their blood sugars and call it in and
Yep.
monitor their insulin, why are we not going to believe them with fetal movement monitoring? Like,
Yep.
that's a big one for me. That's a
Hmm.
big one that I struggle to understand because this is something that only mom can tell you is happening. And so, why are we not believing them? So, treating them with dignity and respect,
Mm,
believing them when they tell us something is wrong. That goes into
totally.
that intuition, right? I think then that shared decision making, like, this is what we're going to do, these are our options, this is what we can do following our algorithm that we have from A1. Does that feel reasonable to you? Does that feel like this will help you feel better about your baby? Like share in that decision making. And if they choose to do fetal movement, monitoring, like that's a decision. How do we support that? Like how can you
Hmm.
make that possible for them if they express that they want to do that?
Yep.
Normalize it, you
Yep.
know? And then I think the evidence, we've talked a little bit about the evidence. Of course, we have links and all those things on our website to point to those articles. We're participating in research. We work with researchers. We want to know more about it too, as well, right? Like we want to be curious about it. We want to learn from it so that we can forward the education, right? Like we want to be a part of the solution and improve these outcomes. You
Hmm.
do that with evidence-based care. So I
Yep.
think that's really important. And then advocation is really important. That's something that, in my webinars, the call to action is, how are you going to turn around and teach your patients about this? Just what you did, that role play at the beginning. And working with teams that are working alongside medical providers to really, everybody's got to be saying the same message, right? Everybody's got
Yeah.
to say, know what's normal for your baby. Everywhere you are as a pregnant person, you've got to hear that.
Hmm. I love it. Thank you so much. If nurses were looking to learn more, all this education you're talking about and the app and all that, so how can nurses continue to learn and grow, continue to get better, continue to up level their care no matter what setting they're in, whether that be clinic, hospital, educator, childbirth educator, doula,
Yeah.
even?
Yeah.
What are the opportunities that you guys provide?
We have many things on our website, and a lot of them are completely free. We offer, lots of links to the research. We offer talking points. We offer opportunities to learn. Every webinar that we do, we record. It's on our YouTube channel, so somebody can go back and sit with that. For nurses in particular, that A1 pathway, the
Yep.
algorithm is really great. So we have that continuing education opportunity. In some states, this may be available to you. So I'd encourage you to reach out to us if you see Count the Kicks materials are in your state.
Mm,
Reach out to us and ask. We may be able to hook you up with a code, um, depending on how those are being used. If not, they're very inexpensive and you get a CE off of that. So I would just say, that's another opportunity And that's our professional organization, right? A1's the professional organization that we can lean into. So where we get our information is also really critical. And if our
Totally.
professional organization is telling us, hey, this is what we need to lean into, then I believe that we do our research so that we can be 100% behind them. But like I said, so many resources are on our website. And I would say if there's something that you as a nurse are wondering, like, I wonder if they do this, please just email us. We have info@countthe.org, or just go on our website and pick a person. We want to hear how this can be better for you, better utilized for you. We want to hear your experiences with it. Is there a way that we need to um, adjust the messaging that we are doing, or share things in a different way with different populations? How do we listen to them
Mm,
and make sure that what they need is there? Like, nurses are such an important key to that because we provide education, right? That's a
yeah.
big part of our job.
Thank you so much for being here and
Yes,
offering
thank you for
all of
having
us your
me.
wisdom and expertise in this. I feel like, I feel like kick counts maybe at like at face value when you see that in the title or something, you're like, oh, okay. But I actually learned so much from you, and I'm excited to continue to push into the resources that you offer. We will link everything down below, including the A1 algorithm that she's mentioned and any other links that you want to include. We will have in the show notes down below. Thank you so much for being here, Sarah.
Thank you for having me. It's a pleasure, and I am so thrilled to be a learner alongside everybody here. So thank you.
We're in it together. Thanks for spending your time with us during this episode of Happy Hour with Bundleberg Nurses. If you like what you heard, it helps us both if you subscribe, rate, leave a raving review, and share this episode with a friend. If you want more from us, head to bundlebergnurses.com, subscribe to our email list, or follow us on Instagram. Now it's your turn to take what you learned today, apply it to your life, and go educate on fetal kick counts. Let's not miss this potentially life-saving and control-giving intervention in our education as we interact with patients and help them have the most positive, healthy birth experience possible. We'll see you next time.